मेरे साथ हैं आज डॉक्टर रियाज अहमद. ये सीनियर डायरेक्टर है इन डिपार्टमेंट ऑफ हीमाटोलॉजी एंड बोन मैरो एट मैक्स साकेत दिल्ली. सर वेलकम टू द शो.
थैंक यू गिन्नी.
सर आज हम बात कर रहे हैं हॉजकिन लिम्फोमा की. होता क्या है ये सर?
Okay, so Hodgkin's lymphoma is a type of lymphoma, broader category. Lymphomas can be divided into two parts, Hodgkin's and non-Hodgkin's. Hodgkin is the name of a guy who discovered this type of lymphoma, and the others are non-Hodgkin's lymphoma. So Hodgkin is the name of a scientist who discovered. So Hodgkin's lymphoma is a cancer of lymph nodes basically.
Okay.
So in this cancer you get the node swelling. It is associated with symptoms like weight loss, fever and drenching night sweats.
सर पता कैसे चलेगा कि ये हुआ है? किस एज ग्रुप में ज्यादा पाया जाता है? When do you need to get careful about this?
Sure. So there are two questions in that. कैसे पता चलेगा? How do we know that somebody has got Hodgkin's lymphoma? So any person who is getting the lymph node swelling in the skin folds of your body. Skin folds is when, like you are saying, this is skin fold. In the neck region or in your armpit area or in the groin region, okay? And there is a painless swelling which is growing over a period of time. You must not ignore it. Painful swelling are generally due to secondary to bacterial infection. They are infective in origin. But painless swelling since last 2 weeks, 3 weeks, 1 month, we must not ignore. And especially if it is associated with what I told you, 3 symptoms, what we call B symptoms. These are weight loss, that is weight loss of 10% of your body weight in last 3 months. Then you have got fever, low-grade fever which is persisting, and night sweats. You can have drenching night sweats and you should not ignore them. Definitely do not ignore them.
अगर आपकी बॉडी में ऐसे कोई भी सिम्टम्स हो रहे हैं एनीवे फॉर अ पीरियड ऑफ टाइम, आपके पास एक डॉक्टर के पास विजिट schedule करना is absolutely essential. Sir, is there a certain age group that we are looking at? Obviously not all of it, but majority?
Yes. So any cancer can happen in any age, but this Hodgkin's lymphoma is particularly more common in 2 age groups. One is teenager groups, so 15 to 25 to 30 years, and the second is more than 60 years. So see in this age group, this decade of your life, these type of cancers are more common.
When we talk about any sort of cancer, there is a thought that cancer ultimately has very big side effects. Is that true?
The word cancer is shattering. I do understand that sometimes we have patients not telling to their relatives. They try to avoid the conversation in front of them, but ultimately you have to face it. So cancer, yes, if it is diagnosed late, or you present with complications, things can be scary. But if you are able to diagnose these things very early in your stage, when it has not spread to different parts of the body, it's easily controlled. The cure rates can be in the 80%, 90% of the cases will get cured for life. You can lead a very normal life.
When you say lead a normal life, how long does it take for a person who's got Hodgkin's lymphoma to come back to normal life?
Sure. So generally treatment regimens, what has been designed is 6 months to 8 months. The chemotherapy regimens in which the drugs which are used are basically for 6 months. When you combine with immunotherapy these days, last 10 years, there are 3 powerful immunotherapies has been there. And when you combine with low-dose chemotherapy, it's generally 8 months. So the best part of this using immunotherapy and chemotherapy is the cure rates have gone up to 80-90%.
That is fantastic. So whenever we talk about, say, either you're talking about Hodgkin's lymphoma or you're talking about any form of cancer, there are 2 sorts of people who get involved. One is the patient, one are the caretakers. The caretakers need a lot of emotional handling. Patients need a lot of emotional handling.
Yes.
Being very busy as doctors as you are, how do you handle that?
So one rightful thing, all our focus is on the patient, and we generally ignore the patient caretakers. They are very important. It's like the person, if somebody is getting cured, it's just not because of the medicines or the doctors or the hospitals. It's the basically caretaker who are standing solid, firm behind their patients. They are looking after their patients 24/7, 6 months, 8 months, years together, and we must acknowledge them. So they are the people who will bring the patient on time, will feed them, will give them psychological support. So they also need some assurance, they also need a pep talk to keep their morale up. They can be your brother.
So
they can
hospitals
be-
have?
Yes, they have. So only thing is sometimes we are busy. It's not like that I'm very super busy and I cannot talk to my patients. We generally talk a lot. But generally it's the patient. And the family also we talk, and once we have explained them, it's not, people are not like fully educated that okay, one day, one talk and things
ठीक
are
हो
changing.
जाएगा.
It's not like that. You may need reassurance. The same thing you need to keep on telling to your patient, keep on telling to your the attenders, caretakers. Basically, you have to pamper them. You have to give them confidence. What I say more, the better your communication skill is with your patients and your caregivers, outcomes really change. If you give them positive feedbacks day in day out, they will cope up with the treatment. They
Much
will
better.
listen to you. Even if the complications, they will say, I have been told all these things, I understand this, and they will cope it better.
Perfect. Sir, अगर हम इस disease की बात करें, how much of a difference does early detection make?
Very much. So we say early detection is the chance for your cure is very much. Early detection means it is localized disease. It has not spread to different part of the body. Okay, so detection early first stage cancer is cured 80-90%. I'm telling people are getting cured. Not all stage 1 cancers are, will say 100 out of 100, but yes, you can say 90 out of 100 people will
Especially
be cured.
if you look at the time range over the last 10 years, I think this number has increased to a large extent. तो डरना नहीं चाहिए. I think that is something that
Yes,
you've said
yes, yes.
constantly. Don't get scared. I think your biggest people who should speak up are people who are survivors themselves.
Yes. So we live in a society where we try to hide all these things. We are scared if the people will know I'll not get job, I will not get married. Society may treat us as untouchables. So this is not correct. Means it's. I know a lot of people. I have treated a lot of people who have been cured of this. They have gotten back to the society, and they do speak up. Some are from the support group program. They have now making it more visible through social media. They come up, speaks up. So, but this education, I always tell, have empathy. This word empathy is very
Very
important. Very important. You should be empathetic. I'm not saying you go and see them with a different eye. You have empathy. It's not, they will take care of themselves. The relatives will take care of their patients in a very good way. But you should have empathy. So and anybody can be, if I'm okay today, I can be a patient tomorrow. It's not like that somebody has got something problem with them. Anybody can be. So we are
And
1.4
understanding
billion,
is-
so understanding and giving them due respect. Understand these are people who require specific treatment for some time. You have to be empathetic to them. Show
And
them
give
that
them space
yes,
as
yes,
well, I
yes.
think. That's
Their
essential.
space. And speak up once you are cured of the disease. Tell them your journey. That yes, it was difficult, but I finally won. Life is more beautiful than anything else. And if once you have defeated the disease, you are winners in your life.
You know, there are lots of these actors who've had cancer in the past, whether it's Sonali Bendre, etc. They've actually become role models or icons that if they can come back on screen to such a huge extent, that
Yes.
so can be. Yuvraj Singh is one of the biggest examples. So as much as you speak about this, the better it becomes. Sir, I'm going to do a quick myths versus fact with you for Hodgkin lymphoma. Sir, what are the common myths? One of the common myths surrounding it is that it only happens amongst older people.
No. It's not like that. See, I told you this Hodgkin's lymphoma, 2 age groups are more commonly affected. One is teenage and another is elderly. So teenage is a time when people start dreaming of their good life ahead. And once they come to know about this disease, the world is shattered. So most of the patients of mine who have, they generally don't ask me about cure. They are more worried about their attending class or completing their graduation or going back to their work. So I tell them
It's a
this is
great
a
thing.
positive sign. It's a great thing. They will not ask that whether I'm getting cured or not. They are saying, okay, whether I will be going back to my normal life, they want. Maybe this is secondary, but it's a good thing. So giving them hope, telling them it's just a small time that you are going to get affected by this, and you just have to carry on with your treatment regularly. Follow us, follow your doctors very patiently. Listen to them. Whatever your side effects are, please tell them everything can be taken care of.
Hopefully, yes. Fingers crossed. Myth 2, swollen nodes always sort of lymph nodes mean it's cancer.
No. So I told you, any lymph node swelling is not cancer. More commonly, which mimic the lymphomas, are tuberculosis. In India, tuberculosis is very rampant. Any node swelling in any part of the India, the first thing which comes to clinician is tuberculosis. So most of the time where diagnostic modalities are not there, they will be started on anti-tubercular treatment. Only when they have taken 2 to 3 months of treatment, they will realize that, okay, it's not TB, and this happens in 10 to 20% of the cases. So the person who is not getting better, or they have been started on ATT just on clinical suspicion, should always have a second opinion. So they should not waste their time. 10-20% of the patient of which visit us have already been on tuberculosis treatment. So once they visit us, we reevaluate and then we tell them it's not tuberculosis, it's Hodgkin's lymphoma. The symptoms of tuberculosis and Hodgkin's lymphoma is almost similar. So it's very common to be misdiagnosed as TB.
There's a question a lot of people ask, that if Hodgkin lymphoma comes back, are there no options left after that?
No. So it's totally myth. Hodgkin's lymphoma is a type of disease where you can say them the cure rates, even if you have relapsed twice, you can be cured of the disease. So most of our patients will get cured with first line therapy. Even if the disease comes back in, you can say 20-30% of the patient, then we do high dose chemotherapy followed by autologous bone marrow transplant. With that, 50% of your patient will get cured. Remaining 50, you can counsel them for allogeneic transplants, immunotherapies. So I can say only 8 to 10% of the patients that will be life is tough, but 90% of the patient gets cured.
So you've got to look at the positive more than anything else. So last words for our audiences.
Be patient, take life in a better outlook. Life is beautiful. Even if you have got every person faces problem in one way or the other. So this is not your final, cancer is not a death sentence. This is not your final verdict. You have to fight back, and you can contribute to society once you're better, in a much better way. You can be anything what you want.
I love that. Thank you very, very, very much. That, of course, is Dr. Rayaz Ahmed, Senior Director, Department of Hematology and Bone Marrow at Max Saket, Delhi. Thank you, sir.
Thank you very much.